Hello, everyone. My name is Mohammed Al-Mahal. I am the Director of Programs of the Sudanese American Medical Association. Um, this presentation is going to give an overview of our new program, ECHO program, Pediatric ECHO program, which are planning in the upcoming 2024 year. So a brief introduction about our organization. SAMA is a nonprofit organization that is registered in the United States since 2008, and also we established our office in Sudan since 2017. Our main mission is to leverage donations of funds, medical supplies, and services from the United States and worldwide to improve the livelihood of our kindred in Sudan. So regarding our scope of work, before the war, our main focus was in education, mainly through Project ECHO, and also establishing surgical missions and providing medical supplies to hospitals in Sudan. After the war, which started on the 15th of April 2023, SAMA shifted its work mainly into relieving the suffering from the internally displaced population in Sudan, which is humanitarian relief. And we also continued in on the education part. Regarding the education, we mainly use Project ECHO model. Project ECHO is a learning model that established in University of New Mexico in USA, and it is a unique model in that it allows for replication of knowledge and democratization of knowledge between people. So during an ECHO session, participants present real anonymized case, and this is one of the pillars of Project ECHO model, is that it is a case-based learning. Those cases are presented to subject matter experts or specialists. And then those cases are on the ground for discussion and recommendations. And then this continuous loop of learning, mentoring, and peer support is what makes ECHO unique, with a long-standing impact far beyond that of a webinar, e-learning, or telemedicine care. And this is the difference between Project ECHO and telemedicine. That is, it is more of telementoring, and we call it all teach, all learn. So as you see in the slide, there is this is from our previous ECHO program, UFK ECHO, University of Khartoum ECHO program. There is a subject matter expert in USA that is presenting his lecture. And then there are different learning sites joining the session at the same time from different low resources areas, such as in Dongola, in Sudan, and in Mogadishu, Somalia, and also in the University of Khartoum in Sudan. And there's also a case presenter who is presenting a real-time case, and then it's open for discussion. So as you see, this model allows for everyone to learn and everyone to discuss the presentation. So as you see, those are the ECHO model guiding principles. So the ECHO mainly relies on technology for amplification of knowledge. So we use technology to leverage scarce resources in low resources areas. And this is important to note that we always encourage people to use whatever technology that they have for learning. And then we usually use Zoom for our educational sessions. The second pillar regarding ECHO model is best practices, that we encourage people to use evidence-based practices so as to reduce disparities between practices on different locations. The third main pillar is case-based learning, And this case-based learning does allow people to master complexities and to learn about different real-life scenarios. The fourth thing that we have in ECHO model is database that we use applications such as iECHO platform and RedCap to deliver our sessions and also to monitor our performance through surveys that filled by the participants. So those are the summary impact regarding our Project ECHO journey with SAMA. SAMA has been a Project ECHO Hub since 2021. And then we have educated more than 3,000 learners, mainly with a focus in Africa. And we recruited more than 100 subject matter experts from all around the world. We have conducted more than 80 ECHO sessions, and our learners joined us from more than 65 countries all around the world. So a brief talk about our past projects. The first one is oral maxillofacial surgery ECHO, and this was an ECHO learning activity that targets oral maxillofacial surgeons. We conducted 23 sessions, targeted 914 learners, and recruited 24 subject matter experts. We also conducted frontline ECHO, which was mainly to train frontline physicians to diagnose and treat acute cardiac emergencies. This was 14 sessions with 470 learners and 9 subject matter experts. The third one is surgery ECHO, and this was provided to house officers and recent medical graduates on teach them on essential background knowledge to deal with the common surgical emergencies. This was 7 sessions, 167 learners, and 12 subject matter experts. The fourth one was University of Khartoum ECHO, and this mainly was to educate junior physicians about the common medical conditions. We conducted 22 sessions with 743 learners, and 54 subject matter experts were recruited. The last one, before all those projects are before the war. So the last one was dialysis ECHO, and this was to teach doctors about the provision of superior patient care that is life-saving and cost-effective for dialysis patients. And this was 13 sessions, about 373 learners joined, and 10 subject matter experts recruited. So as you see, through those ECHO projects, we have a good expansion and a good print all around the world. This map highlights the subject matter expert and learners distribution across the world. And as you see, the orange color mainly highlight just one project, which is oral maxillofacial surgery ECHO. Through this project, we were able to mainly have a grasp on the Africa region. As you see, many subject matter experts and learners joined from Africa in this program. And regarding other ECHO projects, we mainly had an expansion over the US area and the Middle East region. And this is highlighted by the green color. So after the war, our office in Sudan has been closed, and then we established a new office in Port Sudan, and this was named after our ex-director, Dr. Bushra ibn Auf, alayhi rahmatullah. And this is Dr. Bushra Ibn Auf Center for Learning. And it's also now acting as a Project ECHO Hub. So we have continued our message of education even after the war through this hub. After the war, we launched Trauma ECHO, which was launched on the 8th of July, 2023. And this was mainly to educate junior surgeons about managing traumatic war injuries. And we have also launched Dental School ECHO on 15th of July. And this was an example of utilizing Project ECHO model in medical education for educating dental students during the wartime. And then our main vision for the upcoming year is to expand our physical existence in Sudan through building and establishing new centers for learning. As you see, we already had one in Port Sudan, and then we want to establish a new one in Dongola, in Wad Madani, and in Kosti for the upcoming year. Then on 3rd of August, we have met with the American Academy of Pediatrics. We wanted to pursue the education in the pediatric area. We met with the American Academy of Pediatrics and discussed the endorsement of endorsement and co-production of our pediatric educational activities, named the Pediatric ECHO program. And through this Pediatric ECHO, we want to grow Project ECHO footprint mainly in Africa, and also extend Project ECHO in the Middle East region. As I said, we already had an impact there, but through this new program of Pediatric ECHO in collaboration with the American Academy of Pediatrics, we want to grow Project ECHO reach in those areas, the African and Middle East region. So thank you for everyone for listening.